Good morning, McCall's Chapel team. This is John Long, President and CEO of McCall's Chapel School, and wanted to record this presentation this morning and share it with you in hopes of addressing concerns several of you have regarding the vaccine. And uh, let me scroll past this slide first and go directly to the end. And just my disclaimer is, at the end of this presentation, however long it may last, hopefully I'll be able to stay out of the weeds and keep it fairly concise. But I'm going to have an ask at the end. I'm just going to ask those of you that have not received the vaccine if you'll give it some thought. We're going to have an opportunity. We're going to have a chance, by the way, that people in other cities, other states, other locations would jump at if they had. We're going to have Walgreens back on campus on February 2nd. And my ask is for you to give it some serious thought and to please get the vaccine when they come back on campus. So that's my disclaimer. That's where I'm going with this presentation. And wanted to address: are you worried about the vaccine? I love the quote from John Wayne. I guess I'm probably showing my age, but John Wayne said, "Courage is being scared to death and saddling up anyway." If you don't know who John Wayne is, Google him. Just a hero. I've also heard it paraphrased that you can't you can never be courageous without first being scared. And so I get it. I understand it. I know there's a lot going around in our homes, in our conversations with our families, with the internet, with social media, Facebook, yada yada. Uh, a lot of information, some of it fiction, a lot of it fiction, a lot of it creative fiction, and just want to begin to address some of that today. So, what I did, just trying to research, came across a blog at the University of Michigan website, their health website. I thought it was great. I've read through it several times. It's helped me with some of my concerns, some of my questions. And so, I've denoted I want to give the attribution to the source where I pulled this. You'll see in the footer at the bottom where I found this. But just wanted to go through some of the facts and some of the myths and fears that people have about the vaccine. The first of these, the fact is, we have the vaccine now because science and health experts responded very quickly to this pandemic. Um, so the myth or the fear, and listen, I've heard it in conversations I've had with staffs. I've heard it. People are saying, it happened too quickly for me. I'm not sure they did everything they're supposed to do. It was rushed, corners were cut. The bottom line is we got here where we are because this is an extraordinary circumstance. This is something none of us have lived through previously. It's a pandemic, it's extraordinary, it's devastating, and it required extraordinary collaboration, not just in the United States, but worldwide. And those people, those scientists, people far smarter than I am, working together and sharing information and sharing the research, got us here as quickly as they possibly could. We had in this country, in the United States, we had a lot of people hold their hand up and say, "Hey, use me, test me," and that certainly expedited the vaccine as well. So, everything that needs to happen with this vaccine approval happened. Yes, it happened more quickly. Why did it happen more quickly? Because it needed to happen more quickly. Fact, uh, the mRNA-based vaccines do not change a person's DNA. Um, uh, re- Read the myth or fears on the right side here. I mean, some people, some of that creative fiction, misinformation that's being shared on the internet said, you become a transhuman. Um, but if you get the vaccine, and that's just not true. I mean, some of it's just quite frankly, it's silly. So, you know, it, hypothetically, as you'll see down, maybe I can highlight it. Maybe, or, hypothetically possible for the mRNA to be converted to DNA, but it's not likely. It's even if it happened, it's not going to cause problems. So you're not going to become some mutant by getting the vaccine. What to know number three? Fact. Uh, COVID-19 vaccines can cause a short fever. They can cause a headache. They're going to cause you to be a little tired. They could cause you to have a sore arm or chills, especially after the second dose. Um, let me provide some personal color to this because I've had the vaccine. I received the vaccine on December 28th. Didn't feel a thing, and in fact was feeling pretty macho because arm wasn't hurting and had no side effects on the evening of December 28th. Woke up the next morning, December 29th, left arm was a little sore. Like, well, nothing too bad, nothing um, seemingly different than getting a flu shot or any other kind of shot. So no big deal. Hey, that evening, December 29th, arm was really pretty sore. And I think I didn't take my temperature, but I'm pretty sure I had at one point a low grade fever on the evening of December 29th. I took two Advil. The next morning, I woke up, felt fine, didn't have a sore arm, didn't have any sort of chills or any sort of fever, and have been fine since. That's my personal experience. So the bottom line is, tens of thousands of people were tested in the clinical trials every day, every hour, every minute. We're getting more people to receive the vaccine. People providing the vaccines, the states, the federal government, asking people to track and report their symptoms, so that we can have more information to share. But the fact is, if you have side effects, it's proof that the vaccine's working and doing what it's supposed to do. So yeah, you might have some uncomfortableness, but it will not be long lasting. What to know number four? Fact: the COVID vaccines do not contain a live or whole coronavirus. They don't contain microchips. They don't contain tracer technology or fetal tissue or stem cells or the mark of the beast or pork products or fairy dust or this, that, or the other. Again, imaginations are run wild in this. There's some creativity. The bottom line is the first two vaccines, the Pfizer, the Moderna, they've got a little bit of genetic material. They've got salt, they got sugar and fat. The ones that are coming down the pipe are going to have inactive forms of the common cold. Again, you may have symptoms, but substances commonly found in many vaccines. What to know? Point number five. Fact is, people who are pregnant, breastfeeding, or want to become pregnant can get vaccinated against COVID-19. Should they talk to their medical provider? Yes. To me, as you read the bottom line on the right side, this is the question that I go to on everything. Where's the bigger risk, getting the vaccine or not getting the vaccine? In this case, they talk about the virus, the COVID-19 virus increases risks of miscarriage and stillbirth. The risk of not getting the vaccination for someone who's pregnant or breastfeeding or might want to become pregnant is greater than getting the vaccination. And I feel that way on several points. I know you're not necessarily concerned with what I feel, but that's a point of view anyway. What to know number six? The vaccine can end the pandemic much sooner. It can end the pandemic with fewer lives lost. This is especially important to the people that we serve, the higher risk groups, the vulnerable population that we have at McCall's. Rumors and the fear the vaccines designed to control or eliminate certain groups within our society, mind control or elite members of just not true. Again, fiction and creative fiction. The bottom line uh, is people are dying because of the virus, and the quicker that our country, listen, our facility, our city, our state, our country. Bottom line is the sooner we get vaccinated, the better off we're going to be. What to know, number seven, coronavirus is changing. It mutates, but the vaccines are designed to help the body recognize it based on multiple parts of the virus. So this is, as I understand it, commonplace with all sorts of viruses. Um, Common colds mutate, um, but the vaccine makers so far are saying that the mutations that they've seen, the vaccine is still effective, still works, and can't be outsmarted, at least so far, by the coronavirus, by COVID-19. So I'm back to my ask, and that's all it is right now is an ask. Um, but I genuinely feel that you will do best for yourself first, and for our residents second, if you'll get vaccinated. I know it's uncomfortable. I know there's uncertainty. As I said to someone earlier this week, yes, there's uncertainty with the vaccine. However, there is certainty without the vaccine, and the certainty of none of us getting vaccinated, or the certainty of their, if a vaccine didn't exist, the certainty is we're going to be dealing with this virus and the death and the complications it brings to us, and the altering of our lifestyles and our normalcies for many months, if not many years. We can all act, get vaccinated, and cut that time frame that the pandemic impacts us all, uh, to be shorter. And I ask you to consider doing that on February 2nd. Please know, listen, it doesn't work this way. You can't on the morning of February 2nd decide, okay, I'm going to get the vaccine. Walgreens, who's the partner that will be coming here on February 2nd, will have to know well in advance how many doses to bring. If they bring too many doses, if they bring 100 doses and we only have 50 people show up, they've wasted 50 doses because they can't be used the next day. So we need to know on Tuesday, January 26th, by Tuesday, January 26th, if you'll get vaccinated on February 2nd. Folks, I'm asking you, I'm begging you, to consider getting the vaccination. Thanks for listening to the presentation.